Well, there are many types of cancers, each targeting a specific area of the body. Today, we're going to learn more about a more common form of cancer that affects women, endometrial cancer. Here to tell us more is Nurse Christina Paris from the VA. So good morning, Christina.
Hi, good morning.
Thanks for joining us as always. And first off, what is endometrial cancer exactly?
So this topic actually came about because I have a friend's mom who was unexpectedly diagnosed with endometrial cancer, and I am the least knowledgeable about women's health. So we're going to learn together.
Great.
So this is what it is. So it deals with the uterus, and that is one of the female organs there, and it's actually the lining. So within the uterus, there's two linings, and the outer lining is the endometrium, and then the inner lining is a thick, muscular lining. And so this deals with that outer lining, and it actually is one of the most common gynecological malignancies, and it affects women mostly postmenopausal.
Got it. And so how can someone know maybe if they're at risk for developing this specific type of cancer?
So there are a lot of risk factors, just like with any kind of cancer. So obesity is one of them. So being obese, it can increase your risk because body fat alters the body's balance of hormones. So losing weight is a good way. Older women, like I said, postmenopausal, that's really big. Never having been pregnant before or carried a baby to term and delivered, that puts you at risk. Diabetes, polycystic ovary disease, which are cysts on the ovaries, extended use of tamoxifen during breast cancer treatments, and, of course, family history.
Got it. Okay. Well, that's a lot of information. And are there special tests, I wonder, that we use to maybe diagnose this specific type of cancer as well?
So, right. Women should go in every year and see their doctor for a routine annual exam. Even if you're premenopausal, postmenopausal, teens, we should all be getting in. And you should have a PAP done. And even though the routine PAP typically looks at the cervix, which is the bottom part of the opening of the uterus, it also could have some atypical endometrial cells in it. So that's really important. Anytime you have any kind of post-menopausal bleeding, any kind, you want to go in and see your doctor because that's really big. Pain. There's ultrasounds that can be done too.
Good. That's really important to keep in mind. And how do we treat this form of cancer, and what is the prognosis?
Yeah, so treatment typically involves a total hysterectomy. They can go in and kind of clean out and try medications. Depending on how involved the cancer is, will determine what the prognosis is. If it's caught early, you can have a 98% cure rate. So if really, getting in and seeing your doctor is the big thing. Pregnancy, you can get pregnant. It's rare that younger women get endometrial cancer, but if you do, you want to talk to your doctor because there are things that they can do and treatments that they can do that can help with that and allow you to be pregnant.
Obviously very important to keep in mind and keep on top of our health there. Well, thank you so much for sharing all that great information, Nurse Christina. We look forward to speaking with you next week.